This is a PowerPoint presentation with information about what a community is, different aspects of a community, a windshield survey that I conducted on Eau Claire, Wisconsin, a data generation of Eau Claire, Wisconsin, and information about my chosen community project. A community may share commonalities such as geographical location, population, access to resources, entertainment types, and available work opportunities. In order to effectively evaluate a community assessment may be conducted. A community assessment gathers relative information to represent a specific community. The assessment might take place prior to the implementation of a change to assist with the planning process. Prior to conducting a community assessment, a problem may be identified. The assessment can help community members recognize a potential problem and evaluate how to make an improvement. ADPI, or Assessment, Diagnosis, Plan, Implementation, and Evaluation, is a guideline that can be used to determine which stage that the community is in. My community is Eau Claire, Wisconsin. Eau Claire has a specific population, number, and types, is located within the Midwestern portion of Wisconsin, and has other commonalities such as resources. It is important to meet the needs of the population. This can be done by improving the community with better access to resources and services. Some common community needs within Eau Claire, Wisconsin are access to healthcare services, jobs, entertainment, housing, education, and more. A windshield survey is done when someone drives around a specific area and evaluates the community from the comfort of their vehicle. Observations can be made about a city that can be both subjective and objective. There are residential and commercial areas within Eau Claire, Wisconsin. Eau Claire, Wisconsin has 70,157 people and 3 different zip codes, 54701, 02, and 03. Eau Claire has an urban feel with large amounts of stores, businesses, healthcare facilities, and houses. Eau Claire has safe neighborhoods with mild to moderate amounts of traffic and minimal real estate available. It's a well-maintained city with low rates of homelessness and lots of job opportunities. The religion is predominantly Christian, and the majority of the churches are Lutheran. The 3 major hospitals are Mayo Clinic, HSHS Sacred Heart, and Marshfield Clinic. There is a wide variety of other clinics, dentists, and chiropractor offices. Eau Claire, Wisconsin also has various homeless shelters available, being the Sojourner House, Hope Gospel Mission, and food pantries. There are senior centers, assisted livings, and nursing homes, along with a variety of different daycares. The majority of the houses in Eau Claire, Wisconsin are single-family homes, typically newer builds, less than 30 years old. They generally have sidewalks and driveways. There are indoor sports centers, the YMCA, the Boys and Girls Club, and different parks and dog parks for entertainment. The roads are easily accessible, and it's located 1.5 miles to the cities in Minnesota. The roads are well maintained, and there are stoplights. Eau Claire has low crime rates, a fire station, and no evidence of neighborhood watch programs with various gated communities. Data generation is an evaluation of a population's demographics. Through data generation, we can determine specific themes and trends within a community. For example, the population density. There are 28,134 housing units with an average density of 878 per square mile, and the majority of the population in Eau Claire, Wisconsin is white. Data generation continued. Eau Claire is projected to grow 0.64% in the next several years from 2019 to 2024. The average income is $68,000, making Eau Claire generally middle class. 32% of people in the workforce have a bachelor's degree. The average home property value is $143,000. The average taxes are $3,000 per year. The median age in Eau Claire, Wisconsin is 31. 98% of the population speaks English, and less than 1% of people speak Spanish. 92% of people have health care coverage with a variety of different plans through employers, Medicaid, and Medicare. In 2014, the average person spent $8,000 on healthcare-related expenses. There are numerous healthcare providers within Eau Claire, Wisconsin, and they see generally 1,247 patients per year. 1,322 participants were surveyed through Mayo Clinic, and the population stated that they had major issues with mental health, obesity, and chronic disease prevention and management. Mental health hospitalizations exceeded the national averages since 2000. 16% of 10th to 12th graders have contemplated suicide in Wisconsin. 21% of the population is considered inactive, with 29% of children ages 2 to 5 being overweight or obese. Wisconsin, and Eau Claire in particular, has 23.7% of the population admittedly drinking excessively, and 1 out of 14 adults in Eau Claire, Wisconsin is diagnosed with diabetes, and there were 47% of deaths in 2012 caused by cancer or cardiovascular disease. Working with Strong Bodies is my chosen community project for our clinical. Strong Bodies is an evidence-based program that focuses on elderly fall prevention, strength training, balance, and coordination. I partnered with Kimberly Strasberg, who is a trauma prevention coordinator and RN at Mayo Clinic, to help her with the class. She's an instructor at Strong Bodies and is responsible for leading exercises and managing equipment. For this clinical, I created brochures, flyers, and a presentation to educate the community about fall prevention and Strong Bodies itself. The class is held twice per week at the Fall Creek Village Hall and is a large open space for exercise. And we've had several resources and assets that have benefited the community about fall prevention and, generally speaking, for the elderly. While working within the Eau Claire, Wisconsin community, I developed a community health diagnosis. The diagnosis is risk of preventable falls among the elderly population in the Eau Claire, Wisconsin community related to a lack of physical exercise programs within the area that focus on strength training, balance, and coordination, as well as a knowledge deficit among the elderly population about fall prevention and what to do in case of a fall, and a lack of staff members for fall prevention education. The elderly population is poorly represented within my area, and there are limited resources available to help elderly people remain active. Also, there's a high prevalence of elderly falls and hospitalizations related to them within my community. The objectives are the aspired goals of our interventions, and our objectives throughout this clinical were that the elderly will attend 2 Strong Bodies classes per week, will improve in strength, balance, and coordination within 30 days. The elderly who attend at least 1 Strong Bodies class will receive fall prevention information and education about the importance of strength training to prevent future falls. The elderly within the Eau Claire, Wisconsin community will become aware of strength training classes within their community. My community health plan is a plan conducted to educate the public about elderly fall prevention and help elderly people gain bone and muscle strength to prevent falls. The plan also attempts to help elderly people know what to do in case of a fall. And my plan involves encouraging the elderly people within the community to exercise and get involved with Strong Bodies, strengthen their bones and muscles to prevent injury after a fall, educate elderly people about how to prevent a fall by avoiding rugs, needing adequate lighting, using assistive devices, and limiting floor hazards. And working with Kimberly Strasberg, we've been able to educate the public, learn more about community health nursing, involve community members in health promoting techniques, and community awareness about the high prevalence of elderly falls within our area. The interventions that I implemented during this clinical included flyers, brochures, a presentation, and assistance with community education on elderly falls. The flyers just had information about class times, locations, and the benefits of strength training, and then I hung them up around the community just to get the word out about the class. The brochures had information about fall prevention and what to do in case of a fall. The PowerPoint had more information on class times, locations, and the benefits of strength training. And we educated the public about fall prevention, and we discussed the need for different exercise materials and resources for the Strong Bodies class specifically. After a plan has been implemented within the community, it's important to evaluate the effectiveness of the changes. This can be done by determining the number of new participants at Strong Bodies, especially after the flyers were placed around the community. In our case, 2 new participants attended the class after having seen the flyers at a local community spot. It would be important to also interview class participants and evaluate the effectiveness of the class and the materials used for education. Class times and locations may need to be adjusted to accommodate for those unable to attend the classes. Education materials may need to also be adjusted to better meet the needs of a specific population. In conclusion, it's important to remember that populations are always changing. It's important to evaluate a community's needs and their current access to resources and services and adjust those needs accordingly. It's important to develop partnerships with people in the community, identify resources that we currently have and what we need, recognize assets, and evaluate for interventions after implementation. The community has its own meaning, and everybody in the community shares a commonality.